Hi. Hello. I'm right at 1:30. I'm on time today. Yay. Hi. Thanks for joining us. Someone let me know if you can hear the audio okay. I always want to check audio before I get too far here. I don't want to get ahead of myself. Make sure audio is working. If someone can just say that they can hear me, that'd be awesome. Thanks for joining. Hi. I see hearts. Can you guys hear me okay? Yep, good. Thank you so much. I appreciate that, Amanda. Awesome. Hi, I'm Gretch. I'm with Never Talks, and I primarily run the Never Talks page. And it has been a while since I've done a live on here. I don't even know when the last one was now. And thanks for the hearts. And I'm really pleased to be here today and to bring Angelika, one of our team members, on a live to tell her story. And it's been a long time coming. We had some trouble finding a date that worked for both of us. And so we opted for a weekend because we have husbands watching kids so that we could hop on and do this today. And I'm going to bring her in just a second, but I just want to make note that she is a busy mom, a clinical pharmacist, and still finds a way to volunteer for the Botox to Sport Side Effects group. That's our support group, and I am so thankful for her. She was a moderator for a number of years, and now she's more in a research and advisory role to our team, and I'm just thankful for her. Angelika is an amazing woman. I'm really excited for you guys to meet her. So I don't have like some big intro planned today like I normally do because I feel like her story is standalone. It really speaks for itself. And so I want to bring her in pretty much as soon as possible. I see a lot of people are joining. Would love to know where you guys are joining from. Like, list your states, your countries. That would be really cool as we go along. And let's see here. Okay, I think that's pretty much it that I had. And I just want to collect my thoughts here for just a second and hope, wish, and pray that this live reaches the right people. We need to get this information into the hands of the people because every single day, people are still getting injured from botulinum toxin. Every single day it's happening. And our goal is to increase patient safety and informed consent. And so I hope that this reaches people. Please share it. I'll be sure to upload the live into the regular placement on the page when we're all done. And so if you can't stay for the whole thing, don't worry. It will be, a replay will be there available. Okay, so I don't even remember how I do this because it has been so long. So let me just look here. I press the plus button. All right, I'm going to invite Angelika. Let's see, A-N-G. It should come up right for me here. Okay, I see it. Okay, Angelika, I'm going to a second for it to connect. So many people are joining. Oh, and that's the other thing. I have to thank the community for sharing the different reels that we did, like the little clips of Angelika's story. Like that surpassed our expectations in every way possible. So thank you for sharing that. Hi, I'm going
Hi,
to
Gretch.
fix my camera. I don't want to be that close. Oh my goodness. It's like, whoa. Hold on here. Is that better?
It's good.
Move it up a bit. There we go. That's better. Hi, Angelika. Thank you so
Hi.
much. I'm pleased that you're here.
I'm very glad to be here with you.
That's awesome. I have my questions here. So I kind of follow a little bit of a question script with guests, you guys, because it helps me stay on track. And I just kind of like to have some consistency with the lives. But if you have questions that come up while Angelika is telling her story, type them in the comment section and we'll do our best to go over those. And then at the end, if you're okay with it, Angelika, we'll do like kind of like a question answering time period where people can ask official questions if they want.
Yeah, of course.
Awesome. Okay, let me get my questions ready here. Got my computer. Okay, first question, number one. Tell us what life was like prior to receiving your injections. Like, tell listeners just a little bit about yourself and help us establish kind of like a good comparison between what life was like before you became ill versus what it's been like since.
Yeah. My name is Angelika. I am a clinical pharmacist. I've been working in the hospital setting for almost 10 years. I currently live in Kansas City with my husband and my 4-year-old daughter. And, I've been thinking about the best way to tell this story because I was one of those people that had Botox injections, developed some side effects that I did not understand were side effects, didn't connect the dots, then got another injection that changed everything. So I want to take you back all the way to the beginning. We'll go back to 2019. And before injections, I was living the best years of my life, I would say. I had recently graduated from my pharmacy residency. I had started my first big girl job. I had met a lot of good friends through that. I had just met my husband, and we were all living downtown. So we would walk to the grocery store, walk to the gym, walk to the country concerts every Thursday night. And so I was just living a very normal, healthy, active life.
Mhm. Mhm.
And I would say what originally compelled me to get Botox was my upcoming wedding. And, I was nearing 30 and I had noticed some new fine lines and wrinkles in my forehead, and I wanted to erase them for my wedding day.
Mhm.
And I went to a very popular med spa in my area. It was about 20 units that we did just in the forehead and the 11 lines. And I remember signing like an electronic waiver. There was no discussion of side effects that I remember. Maybe there was a mention of like bleeding or bruising from the injection site. That was about it. And, if I'm being honest, I loved my results initially. I felt youthful and I felt confident, and I understood the hype behind
Mhm.
everyone getting their tox. And I got it, I would say, a handful of times leading up to my wedding. And somewhere in that timeline, it's hard for me to pinpoint when this started happening because it was so many years ago now.
Mhm.
I had developed a mild difficulty swallowing solid food. And it felt like I needed a sip of liquid to wash down every bite of food. So that's what I did. And at the time, I attributed it to stress or anxiety, or I didn't know. I just kind of brushed it off. And it wasn't all the time, it would come and go. And so I never got anything checked out, and I had no idea that that was the start of toxin spread.
Mhm.
So then I got married in 2020. I had my daughter in 2021. So for a while there, I obviously wasn't getting any tox. And it was about a year postpartum that I started noticing one side of my face looked swollen compared to the other side. And I started noticing it in pictures, and it was starting to really bother me. And I was at a routine dentist appointment, and I asked my dentist if this had something to do with my teeth or what he thought. And he, felt both masseter muscles, my jaw muscles, and he said, your masseter on the right side is much bigger than your left. And he suggested that I get Botox on the one side to kind of even them out. He thought that I was clenching and grinding my teeth at night, and he said that that would also help with that as well.
Wow.
And so when people ask if I got this last injection for medical or for aesthetic reasons, I would say it was kind of both.
Yeah.
So on August 27th of 2022, I went and got the masseter Botox. It was at a very highly rated med spa in my area. It was a different med spa than I had been to previously.
Okay. Mhm.
Different injector. He was a nurse practitioner. He seemed very knowledgeable, very professional. He had printed off studies of Botox for masseter hypertrophy, which is what we were using it for.
Yep.
We went through those studies together. He outlined what he was going to do, that we would do a conservative dose. And so he suggested 30 units in the masseter broken up into 4 separate injections. And
At the
while I was
same
there,
time, I'm sorry, at the same time or four
yeah,
separate
just
treatments?
incrementally.
Oh,
Yeah.
right. Okay, got it. Thank you.
And So while I was there for the masseter, I said, well, why not do the forehead too? So
Wow.
all together, it was 55 units, the
Mhm.
masseter and the forehead. And I remember him mentioning the bruising as a possible side effect as well. And I do remember he said that the worst that can happen is a droopy eyelid.
Oh, okay.
And that was the discussion of the side effects at that time. I remember this day because a couple hours after, I went to a friend's baby shower. And I remember at the baby shower, I was having trouble eating a cupcake or whatever sweets I was having at the party. I remember having a lot of difficulty with. And I remember driving home from that shower feeling really off. I had developed a headache. I had these intense feelings of anxiety and panic that I had never had before, and just really didn't feel good. So went home, took it easy. Again, still at this point, not connecting any dots.
Right.
Over the next several weeks, things waxed and waned. I had good days where I could eat totally normal, and then I had days where I was having a lot of difficulty. And it was really the end of October, about 2 months later, that I felt things worsening. We had taken a trip to Nashville to visit some friends, and my girlfriend had made me like a greens powder drink. And I remember I couldn't drink that drink that she made me.
Huh.
And I remember thinking that was really odd because up until that point, liquids were not an issue for me. It was only with solids. And so that really scared me.
Yeah.
Which brings us to early November. One morning, I couldn't eat yogurt. I was trying to eat yogurt, I couldn't swallow it. And so I finally turned to my husband and I said, you stay home with the baby. I'm going to urgent care. And before I went to urgent care, I was doing some Googling, some researching, and I finally found your support group. And once I searched trouble swallowing in the search bar, and hundreds of women's posts came up detailing the exact thing that I was experiencing, I knew then that my symptoms were 100% due to the toxin.
Mhm.
So I go to urgent care. The nurse practitioner had no idea what I was talking about, had no idea what iatrogenic botulism is. She ordered an x-ray of my throat, which came back normal. She referred me to ENT, and she told me to go to the ER if things worsened. I also got her to prescribe me some pyridostigmine
Mhm.
to try, because I had seen, some studies suggesting that it might help because it can help improve, the muscle contraction.
Mhm.
I tried a few doses of that medication before eating, and I didn't feel like it made any sort of meaningful difference.
Mm.
So I went to the ENT appointment and I told the physician that I need antitoxin. He said that he was not the guy to coordinate that. He had no idea what I was talking about. And so he referred me to a neurologist that he knew who was the number one injector of Botox in the Kansas City area.
Oh, okay.
And so he said, if anyone knows how to deal with toxicity from this product, it would be her.
Mhm.
And so I was really hopeful going into that appointment. I saw her in January of 23. She did a full neurological exam and asked about all my symptoms, which at this point was a lot. Besides the difficulty swallowing, I was having this hypersalivation. I had all this excess saliva pooling in my mouth. And along with the difficulty swallowing, it was so hard to manage my own secretions. So I would have to carry around a spit cup everywhere I went. I had this heightened anxiety and panic that I already said that I had never felt before. I had a lot of muscle wasting. Like I felt like any muscle tone that I previously had was just gone. I had heart palpitations. My ears were ringing. I had inner shaking. I had a lot of autonomic dysfunction. Like I would just be sitting doing nothing. My heart rate would skyrocket to the 120s, 130s, and then it would come back down to the 60s. One of my worst symptoms that I had that only lasted a few months was difficulty breathing at night. I would wake up gasping for a breath. It felt like my body had forgotten to take the next breath. So that was just terrifying when that would happen. I had jaw pain. I had pain at like the base of my head and neck. I had electric zap like pains all over my body. I had neuropathic type pain in my fingertips. Eye twitching, a lot of eye symptoms, dry eyes, inability to focus my eyes at times. So the list goes on, and I told her all these symptoms. And this neurologist basically laughed at me and said, Botox cannot cause your symptoms. She said that it possibly may have triggered something autoimmune that is causing your dysphagia. She said that if it was somehow the toxin, that it would wear off in a couple of months. And she ran a bunch of labs that all came back normal. A lot of rheumatologic type labs looking for something autoimmune. All of the myasthenia gravis labs all came back normal. And after all these came back negative, she never reached out with more guidance or any other thoughts after that. And I remember at the end of that appointment with her, I was at like a really low point because I was starting to have trouble with liquids. Every single sip of water took a lot of effort. And so I just remember looking at her and saying, what am I supposed to do in the meantime while we wait for this to wear off? What should I do? And she said to me to try to eat scrambled eggs and ice cream and sent me home.
Oh my goodness.
And what's really crazy to me being in the medical field is that nobody along this journey asked me to do a calorie count to gauge a real picture of what my function was and how much I was able to take in.
Mm-hmm.
And so that was another letdown. I then found a new primary care provider and I went to that appointment in June. He was the first person to actually listen to me and believe me. And he kind of sat back and said, so you had none of these symptoms before your Botox injections? And I said, no. And he said, and all of this started after your injections? And I said, yes. And he said, well, it sounds like you have a form of botulism. And it was such a relief for someone to finally acknowledge it for what it was.
Mm-hmm.
And he was willing to order me the antitoxin. He said, yeah, sure, I'll order it for you. And he coordinated a phone call with the CDC. He talked to a physician there for about an hour about my case. And they said that they would contact him in 48 to 72 hours to tell him the decision. And they called him back a few days later and said that they declined to offer me the antitoxin. And, I think it was for a couple of reasons that I was declined, but mainly I was 10 months out at this point. And in all the studies, antitoxin has to be given within days of exposure, because the way that it works, it binds free toxin that is still in the bloodstream that has not yet settled into the neuromuscular junction. So at 10 months out, there was no way that anyone was going to offer me antitoxin. And also, as crazy as this is, I was not severe enough to qualify for antitoxin. Despite not being able to eat, I did not fit their criteria because if you're not on a ventilator, if you are not in respiratory distress, if you don't have flaccid paralysis, you do not qualify for the antitoxin. So I wasn't surprised, but I was devastated because I knew that that was my only chance at recovery.
Mm-hmm.
I tried my best to eat for a little over a year. My function waxed and waned. So I had some good days where I was able to eat tacos and some days where I was unable to take a sip of water. So it was really up and down that whole first year. I ate a lot of ice cream because that was an easy consistency for me to manage. Um, a lot of Nutella, peanut butter. You know, my husband would make me dips that he tried to make as caloric as possible. But I was losing a lot of weight. I had lost about 20, a little over 20 pounds overall. And I have a very small frame. I've always been small. I did not have 20 pounds to lose. And so finally in November of 23, so this is 15 months post injection, I was admitted to the hospital. I was so weak. I was tired of trying to eat and knowing that it wasn't enough. I could barely take care of my child. I could barely go to work. And so I knew that it was time to go in. And my goal with that admission was to get a feeding tube because I knew I needed an alternative way to get nutrition.
Mhm.
And I had neurology again, different neurologists come by, again, more gaslighting, more dismissal. No, this is not a neurological cause. Look for other causes. I had gastroenterology come by, I had toxicology, and I had an MRI done of my head that was normal. Lots of more labs and tests done, all came back normal. And so the GI doctors agreed to do an EGD as another piece of workup just to look for anything that could be the cause of my trouble swallowing. So we did an EGD. They looked down, the top half of my GI system, didn't find anything. And so then they placed the feeding tube in my stomach. And, it's been a little over 2 years now with the tube, and it's kind of a love-hate relationship. It saved my life. I would not have been able to go on the way that I was without it. But it also comes with its own set of complications and issues. And, you have to get it exchanged every 6 to 8 months and things like that. So, in some ways, it gave me some of my life back, but it's been difficult too. It's been an ongoing struggle. And I'm now 3.5 years out from my injection, and my swallowing function, I would say, is the same as it was, or even worse than it was in the beginning. Because at least in the beginning, I had some good days, and now it's just bad.
There's no solids right now then at all, or can you tolerate small amounts?
No solids. I will occasionally try sips of liquids, and it's still really difficult. And no solids.
No solids. Has anyone given you like a long-term um, prognosis? Have they seen this before where people do get better, or are they just can't really tell you either way? What's any answers at all?
Nobody has had any answers. I had one more appointment after that hospital stay, and it was with a neuromuscular specialist. And they were just trying to rule out um, rare neuromuscular disorders.
Hmm.
And she did a full workup and ordered more myasthenia gravis labs, and everything came back normal again. And I remember her saying, I think we just need to wait for more research to come out about botulinum toxin. And she was really perplexed. She had no idea. Nobody has known what to do at every step for me. Nobody has been able to give me a guess. I think you and I are the most equipped to give a guess based on, other women that I've talked to in the support group. And I've met women who have been struggling for not years, but decades.
Yeah.
And people who are, 25 years out and they say that they're 95% better. So I don't know what will happen to my swallowing function. I don't know how long it will take, if ever, that it will come back. I'm hopeful that it will, but I'm thinking in terms of decades and not years.
Wow. And I know in the video that was so highly circulated, the reel that you did, you said something along the lines of it's hard to put into words how much this has impacted your life. Can you speak a little bit more about the emotional side of this, how it impacts just your everyday? I know you mentioned that you have to tell your daughter, she's just a little thing, little gal, why you can't eat. Tell us more about what that looks like.
Yeah, it's really hard to describe what it's like to have like a basic function of your body taken away.
Hmm.
And, I think I've realized more than ever how food is at the center of life. Like everything revolves around food and sharing meals together and cooking together, celebrations and events and meeting with your friends or your family. It all revolves around food. And so the emotional piece has been just as difficult as the physical piece. I can't, I'm so limited in what I can do now. We can't go to restaurants for date nights. I can't sit down and have a meal with my daughter. So it's been really, I've gone through all the stages of grief,
I'm sure.
and cycle right back to the beginning all over again. But I think it's just a lot of anger and a lot of grief and a lot of grieving my old life. And I just look around and I think, how lucky are you to be able to? It's something that you don't cherish until it's gone. I just look around and think how jealous I am of everyone around me eating and able to eat and drink as normal.
I can hardly respond. I'm trying to imagine what that would be like, Angelica. I'm so
It's
very sorry.
it is like a dimension of life is just taken away. Like it's like everything's black and white for me now.
Yeah, yeah. And just to survive too. I mean, you
Yeah.
have to survive. And wow, what a reduction in just your overall quality of life in every way. And
Yeah.
it's hitting all aspects of you, of a person, the emotional side, the physical side, the spiritual side, the intellectual side. Every aspect of you has been impacted by this adversely. Hmm.
I think the physical difficulties are one thing and everything, medically that I'm going through is one thing. But the what I was so shocked by was the medical gaslighting and the
Yes.
dismissal at every appointment besides my PCP. Even as a medical professional myself, and I would go in there with studies, with medical literature outlining what I'm talking about, and still the neurologist to just completely dismiss this as a complication and as a possibility just floored me. It's in the black box warning.
Yeah.
Difficulty swallowing and difficulty breathing are in the black box warning, and I had them both.
Yeah. And people too that this has happened to. And the reporting databases reflect it as well, and how many hundreds or thousands of people. And we know those numbers aren't accurate either. Just a very small percentage of people ever report.
Right.
And so, in my mind, it's just pure negligence that doctors don't realize that this is happening. And then
Yeah.
that makes me ask a lot bigger questions. And I'm sure you've asked those same questions in your mind too.
Yeah.
The system is very broken. What's going on here?
The
Yeah.
system is broken. I think the medical community has to catch up and realize that this is a thing, that this is happening to tens of thousands, if not more, of women all over the world. And there needs to be a clear protocol and a pathway. There needs to be answers for people like me who are not severe enough to qualify for antitoxin,
Mhm.
but are have life altering side effects.
Yeah.
There's nothing like that right now.
There isn't. And I know you and I always are looking for the next big thing. And we do so much research and we're hopeful that something is going to come out to help you and to help everybody, but we're just not there yet. And it seems like every possible thing that could help ends up having more side effects. And so it
Right.
becomes this almost this game of like, is it worth it to try? And it's so frustrating. I'm frustrated for you and for everybody else too. Yeah.
I think that's one of the most universal things in the group, is this. new sensitivity to foods and medications and supplements. And that is a whole nother layer of
Yep.
frustration because you're trying to do anything that could help. And yet there are all these things that can actually hurt.
Hmm.
And I experienced a lot of them myself. Caffeine is something I had to give up um, overnight, seemingly. I was always a one latte a day girl.
Hmm.
And suddenly my latte was giving me, palpitations and physical signs of anxiety that I had never had before. And so I couldn't tolerate caffeine anymore. So many vitamins, vitamin D and vitamin B12 seem to be a huge issue for people
Yep.
and for me as well. These worsenings that would happen that we call relapses of
Yep.
symptoms, where alcohol was a big one. So I would have, back when I could still take in some liquids, I would have a sip of wine, and the next day, my swallowing would be worse. So there's definitely something to this that needs to be studied. We
Yeah,
need to study the sufferers.
we do. And it's just not happening enough. The animal model studies exist, but they're just not studying people. And, there's all kinds of issues with studying people, right? Ethical issues and then getting a sample size and people agreeing to it and people connecting the dots that this is that what they have is even from the toxin in the first place. And it just seems like we're so behind. There's a long ways to go.
Yeah.
And when you consider that this was elective use, I'm sure that frustrates you even more. Tell me about if you would have known that this could happen, how would that have, you would have never done it, I'm sure, obviously, you
Yeah.
know.
It will be the biggest regret of my life.
Yeah.
Um, on one hand, there was a lot of self-blame in the beginning.
Mm,
And, it's like I chose to walk into that office and get this injected. But on the other hand, none of us expect this to happen. And I had never heard of anybody else experiencing side effects from Botox before. And it seems like such a common thing. It's so glamorized on social media and
it is.
in the industry and in society. And you just think, well, everyone does it. And so it just seems so safe
Mhm.
and common.
Yeah. And then people aren't able to truly make an informed decision, are they?
I think that's the worst part, is that there's no true informed consent, because these injectors, I don't think they even know what iatrogenic botulism is, truly. I had reached out to my injector throughout this journey, and he said he spoke to his medical rep at Allergan, and they said to look into other causes, that this couldn't be from the toxin. And, I don't know if they don't know or if they're just willfully ignorant. But these injectors, it needs to start with them giving the true idea of what the real risks are
Right.
to
There's
these
such a
women.
difference between becoming ill and having this happen when you feel like you have full informed consent versus having this happen when you had no idea. Like that would really play a role in a person's healing journey, I think. It
I
just
think
adds a
if
whole nother
anyone
layer.
truly knew what
Mhm.
having botulism feels like and all the symptoms that you have and how terrible it feels, I don't think anyone would choose to get these injections.
I agree entirely. And that's why it's so important to have stories like yours and for you to come in and tell this to people because there's just no other way for people to find out what can happen. And nothing in my mind is more impactful than a first person account, you telling your story from your perspective. It really is, it's incredible. And you're so brave and you're still suffering, but yet you're doing this because you want to prevent others from making the same decision you did. It's really, really honorable, Angelica.
Thank you.
You're welcome. Trying not to cry. I'm just going to look at my questions. My questions. I think you've touched on like all of them. You've just done such an amazing job recounting your story. I would ask the people watching. The view numbers have been really high on this live. You guys, thanks for sticking around. And people are saying they're so proud of you for sharing. And I saw some comments come in, which I'll scroll back in a second. But those of you who are watching, is there any questions that you have for Angelica? I mean, it can really be anything. We're happy to answer, Angelica or myself. I'm going to scroll back here a little bit. Um, And while I'm looking here and seeing if any questions come in, I've paid really close attention to the comment section on your videos on the Never Talks page. And it is pretty amazing to me the number of providers that come in there and say this can't happen. Or they say, are you sure you don't have MG, which is myasthenia gravis, which you've
Yeah.
stated twice now you were tested twice for, and that this is not that. It's not an autoimmune myasthenia gravis condition. This is result of damage from the neurotoxin. Someone said that they had that and also thought that they would never eat again, but then something changed for the better. So that's a positive, that someone had difficulty swallowing and got better. Someone, Mon Sherry Beauty says, I feel so sorry for you. I hope you will get better someday. I've had some issues after Botox, but after 3 years, it's getting better. Cheers from Poland. Yeah, this is a worldwide thing. I love seeing the messages come in from other countries. There's some suggestions of doctors that might be helpful. Thank you for that, you guys. We'll definitely check that out afterwards. Okay, I'm gonna
I think a
scroll.
really common question that comes up when people hear my story is why has it lasted so long? People
Mhm.
think, the toxin wears off in 3 to 4 months. So why has this lasted so long for you? And the answer is I don't know. Don't know. Are studies that detail, some mechanisms for the persistence in cells of this toxin.
Yep.
So there's a few, theories out there. But I think one of the main reasons for me is that I was already having toxicity. I didn't realize it in time. And then I got another injection
Yes.
that worsened everything 100-fold. So I think that toxicity is cumulative.
Yeah, yeah, and the early animal model studies from the 1940s when they tested rabbits and mice and guinea pigs, and they tested the summation action of the toxin. And it was crazy because what happened was when they gave small doses to the animals in succession quickly, it ended up being more poisonous to them and causing a quicker fatality than if they gave the aggregate dose or the
Yeah,
entire dose to the animals all at once. And that tells us a lot here. That tells us that that's what's very likely happening to people, I think.
yeah,
And so the more you get, the more damage occurs until eventually the body just has botulism, full-blown
yeah.
botulism. Someone said, do you believe in the toxin bucket theory? I had Botox for 3 years, never had an acute reaction, but I've had a relapse of ME or chronic CFS.
Fatigue.
Yeah, I believe this has something to do with it. I believe it probably does too. What do you think, Angelica?
It's just hard to say because I feel like this toxin affects people so differently.
Hmm.
I think for some people it flares, like an MCAS or like a histamine related reaction. For others, it's more like I had more of like a localized paralysis.
Yeah.
For others,
Mhm.
it's, their arms and legs are more affected. So it's hard to say why did I have these specific side effects and why did someone else have something else?
Yeah.
But, it all points to just the mechanism with which this
Yes.
toxin works, and
Mhm.
it is inhibiting the release of acetylcholine, and we simply need that for our nerves to communicate with our muscles, and so you're breaking that connection.
Yeah. And it
Eh,
depends on where it spreads too. And in different people, it's going to spread to different areas. There's
right.
so many factors that play a role. It is interesting how yours is so localized to that one area. I mean, you had other systemic side effects for sure, but the lingering ones are so specific.
Yeah, all
Yeah.
of my symptoms basically have gone away besides the trouble swallowing, and I still have the hypersalivation.
Mhm.
um, which is interesting too. If you think about those two things, they're opposite. It's like I don't have enough acetylcholine to produce a normal swallow, but I have too much acetylcholine that's producing this excess saliva. So there's just total cholinergic dysfunction, I think,
Yeah.
happening
The whole system.
that we need to study more because no, I mean, I don't understand. The longer I am in my journey, the more questions that I have for researchers. So
Mhm.
we just need more research.
We really, really need more research. Um, yeah. And I know I think of all the different studies you and I have studies shared back and forth and the phone calls and the late night conversations, just trying to pinpoint things. Remember when you were drinking a tea and the tea set you back? So was that was a mint
It
tea,
was
was it?
spearmint tea.
Spearmint
Hmm.
tea. And you had more increased salivation. And I was like, what did you do different? What are you doing? And you started talking about the tea. So we looked at the tea and it was just, I remember that. And you stopped using the tea and you had some improvements. So it was like,
Yeah.
what was it about the tea? I mean, we have our theories, of course, but
Yeah.
you know, Angelica and my favorite thing is to have late night conversations and just conversations all day long about what's going on because the
On a
doctors aren't,
molecular
so we do it.
level.
Yeah. And then we make our own theories. I don't know if they're correct or not. Some people are still joining. Thanks for joining, guys. Angelica has done just an amazing job recounting the story of her Botox injury. And this will go into a replay when we're done here so that you can go back and you can watch it from the beginning. I'm going to scroll back up here. And yeah, yes, are you 100% sure the symptoms are coming from the Botox or botulinum injury? Yes, right. Absolutely.
1000%. Yes.
Thousand
Yeah.
percent. There is no
I,
botulism is a diagnosis of exclusions, right?
correct.
Pretty much.
I have had any and every lab test and image and every possible test done to look for other causes.
Yeah.
Everything has come back normal. I have had EMGs, small fiber EMGs, all of the myasthenia gravis stuff, and all of the obvious things were ruled out. And
Yeah.
I had a pretty extensive workup to do that.
Has your paperwork ever been updated, or did any doctor go in there and say, yes, she has long-term, botulism? Is that diagnosis printed for you? I mean, I know a lot of people don't get the diagnosis because there's testing, but it's not readily available to confirm botulism, especially at the further you get out, right?
Yeah.
Hmm.
I My primary care provider is the only one who has documented that this is botulism. Yeah. And so if you look at all of the notes, the clinical notes from my hospital stay, they are all incorrect. They're all saying this is not a neurological cause, not due to the toxin, look for other causes, yada, yada. And so that was really, really frustrating for me. That was a really low point for me to read all of those back and to know that it was simply not true.
Wow. Someone says, how big are the risks if botulism is happening? Or maybe I think they meant to say, what is the
Of
risk of having botulism or getting botulism? It's kind of all over the place. We don't really have perfect, accurate incidence rates, do we? I know the Zagaran study in what was that 2023 came out and they said 1 in 6 react badly, but that's an adverse event of any type. There's some new research that says pretty similar to that. But again, they're looking at all adverse events, and some adverse events are symptoms of botulism, and some are, like you talked about, other things, immune system responses or systemic reactions. What are your
Yeah.
thoughts?
It's hard to gauge because, I think the numbers are like 1 to 2% of people are actually reporting.
Yeah.
And I think the other difficulty here is a lot of people have symptoms and don't know that they're from the toxin and from their injections, just like I didn't in the beginning. And I'm, in the medical field.
Mhm.
So I think there's a lot of people that haven't connected their symptoms to the toxin. So that's one problem. I
Mhm.
think people who are going to their providers with their symptoms are not getting an accurate diagnosis. They're being dismissed. This is a
Mhm.
common story. This didn't just happen to me. Almost every single sufferer that comes and tells their story has it's a common thread of being dismissed and gaslit by providers. So there's no accurate diagnosis given. And so it's hard to grasp what the real numbers are.
Mhm.
And I think when you extrapolate from the data that we do have, it's probably closer to like 1 in 100 people is going to have a side effect or a reaction
Exactly.
to the Botox.
I would totally agree with that. And I find the repeat injection studies that were supplied by the manufacturer that used to be printed in the black box warning label, but were removed like about 2011 or 2013, somewhere around in there. But that was an interesting study to me because it said that now this was repeat injection sessions showed that adverse events, again, of any type happened in over 40% of people. And I find that to be really interesting because we were talking about the summation action. And here we're looking at repeat treatments, and over 40%, almost, it's actually almost 50% of people were reacting adversely.
Yeah.
And that's no longer in the label. People, you can go to the FDA database or the drugs via FDA.com, and you can look at all of the previous labels to see that information. And it's fascinating to me that it was removed. I don't know why it's no longer printed in the label, but it's not there. Someone says, really good question. Why do some people get symptoms and others can get botulinum toxin for decades and be okay?
Isn't
I
that
have
the
something to
million
say
dollar
about that.
question?
It's the million dollar question, but I do, the research does show that the body is really adaptable. We know this. Our bodies are an amazing piece of machinery, basically, and they can create antibodies against this neurotoxin. And the more antibodies that you have, that's great. The less damage. And so that might be just one factor, but I'm sure there's a ton of other factors. And like Angelika said, it's kind of the million dollar question. But I'll tell you that in our support group, so we have just over about 30 to 35,000 people actively suffering. And then there's a small percentage of people that are there just to learn, and then some medical providers. But what I can tell you is that I'm losing my train of thought. Um, Never mind. I totally lost my train of thought. Where was I going, Angelica? I was talking about the group.
Why some people have toxicity and why others don't.
Yes. Oh, I was going to say we have people in our group that have been using the toxin for 10, 15, even
Yes,
20 years. And then all of a sudden, one treatment like
tips
causes
the
all the
scale.
symptoms of
Yeah,
botulism. It tips the scale. And so it's a really good question, but we don't have
we
a
don't
perfect
know.
answer. Yeah. Oh, people are still joining. Awesome. Someone says the same, this is very similar to the same thing as breast implant illness. Yes, or allergies or other adverse reactions to meds. Everyone is different. Everyone is so vastly different. It's such a good point.
Everything has a risk, right? And people will use that argument with me too, so what? Every medication has side effects, every medication has risk.
Yeah.
But I'll tell you, I have never seen a medication have, a black box warning on it or a list of accepted side effects.
Hmm.
And then sufferers bring that to the provider and say, I think I'm having XYZ side effect from this drug. And they say, oh, no, no, you're not. Actually, that can't happen when it's clearly printed in the warning label. And so I think this is a different beast entirely.
It is.
And
It is.
beyond that, there's no help, there's no option besides
Mhm.
the antitoxin. There's no readily available antidote for when things go wrong.
Exactly. And that is what makes it so concerning, and why people need to have the true informed consent. And they need to understand that should this go wrong for them, there is very little that can be done. And I know your outcome would have been totally different had you have been given antitoxin. I mean, we know that.
Yeah.
We have people now in our group, we have a group of people who were lucky to receive that, and their outcome is much, much more favorable.
Yeah.
Hmm.
Have been able to get their feeding tubes out.
Yeah, exactly. Should we just accept aging, you think? Is that the solution?
I will say this has completely changed my idea of aging, my thoughts on beauty. Um, I think that we really, as a society, need to re examine our thoughts on aging because, this has been like a lesson in the most traumatic way possible that aging is a beautiful thing.
Mhm.
And just being able to age and to live and to have your body function in a normal way, your health is really all that matters. And so, why would you risk everything for in this like endless pursuit of beauty?
Right. And nothing can permanently turn back the clock. It's all temporary. And so you either keep doing it and risk a major impact to your health, or you just decide, I'm going to reframe aging and I'm going to accept it as part of life and just be happy that I'm here walking the earth still. And
Yeah.
that's kind of how I've reframed it in my mind too. And I think it's important to surround yourself with people who agree and are similar in that. It makes it easier, or it does
Yes,
for me, for
it
sure.
does.
I always say one of my lines is, looking good will never feel better than having your health,
Yes.
because
Once there's
once it's
something wrong
gone,
with your health,
mhm,
that's the only thing that you
that
can focus
matters.
on. Yeah.
Exactly. So you have a little girl. I have boys. Angelica has a little girl. How do you plan to talk with her about this? Have you thought about that? I know she's really little yet, but do you imagine those conversations about loving yourself and what happened to mom?
She knows, um, in an age appropriate way, she knows kind of what has happened. She's very smart, and I have never wanted to hide anything from her or lie to her. And so, I was going to be pushing all my meals through a feeding tube, and I wasn't going to hide that from her. So when I think she was maybe 3 or 3.5, I sat her down and I told her that, some people get food in their belly by eating it and chewing and swallowing, and some people have to use a feeding tube to get food in their belly. And I told her something happened to mom's swallow, and I'm going to have to use this feeding tube. And so she's always been very hands on. She wants to help me push, my syringe. So she's very in it with me.
So
And I
sweet.
imagine that as she grows, we'll just have more conversations, and I'll slowly be able to tell her more and more of the truth and what happened, when she's at a point to understand it.
Yeah,
And so I hope that she grows up with a completely different view of the risks associated with beauty treatment. And yeah, I think just the real risks of any decision of anything that you put into your body.
body. Yeah. I think that is such a great way to talk with her about it, in a way that she can understand, with knowing that as she gets older, you will tell her more. And she does sound like a little helper. I can just imagine her. I've obviously seen pictures of your daughter, and I can imagine her helping mom. Someone says, I had Botox injected into my sphincter muscle, and after that, I developed multiple abscesses that needed to be drained, and there was emergency surgeries. I 100% think it was the Botox, and this was 4 weeks. Did your providers agree that it was the Botox? We'd love to know. My guess is they probably said it wasn't. Someone asks about natural treatments to detox your body. Oh, Angelica and I have lots of thoughts about detox, don't we? Go ahead.
This toxin acts completely differently from anything else that you can quote unquote detox.
Any other chemical in the world?
And I am lucky that I found your group when I did, and that I scoured the page. I mean, when I first found your group, I spent hours and hours just flipping back and scrolling through all of the posts and reading. I found your cautions list, or the do not do list, or,
Mm.
just be careful list of things that can cause worsenings.
Yep.
And I saw the stories of many people who tried to detox this, and I understand why they did.
Mhm.
When you have something that affects your life so deeply, you are desperate.
To get
You
it
want
out.
to find answers, you're
Yeah.
desperate to get it out, you're willing to try things. And if I hadn't seen those things, I probably would have tried different detox avenues myself.
Yep.
But in all of these cases, it does more harm than good,
Yeah.
because we don't truly know how the toxin leaves the body. If we had a clear idea of, yes, it goes through this hepatic enzyme and it is
Right.
cleared through this way, then we could maybe understand a better way to detox.
Yep.
But we don't have that
Yeah.
information. And so people who have tried to detox, and there have been a lot of people, have
Mhm.
always ended up worse.
Yeah. Because it appears it moves it, or it flares it, or it does something to it that's
It makes it
not good.
recirculate, or
Yeah, it's just
yeah.
not good. It's a tricky, nasty little protein, isn't it? It's just terrible. And it's very large, very capable. Let's see, are there any? Oh, that's such a good question. Are there any serious side effects from antitoxin? I have lots
Mm,
to say. You can say there are, right? There are side effects.
there
And
are.
yeah, and it
Um,
becomes a weighing the pros and cons, right?
yeah,
Tell us more.
I think the biggest one would be, besides like an anaphylactic or an allergic reaction that can
Okay.
happen. But besides that, like a serum sickness or like a reaction to something foreign in the body, because it's antitoxin is made from like horse serum.
Yep, horse
Um,
antibodies. Yep.
and so your body can have a reaction to that, which then you would need steroids for.
Yep.
So I think that is the biggest risk. I will say for me, my quality of life and my fun, I mean, this was prior to the feeding tube. So it was like my last hope at getting my function back to be able to live a normal
You
life.
would have
And so
tried it
I would have tried it. It would have been
anything.
experimental at 10 months out, but I would have tried it.
I wish they would have tried it on you. I mean, it would have made for an amazing case study to have someone
It
that
would.
far out, use the antitoxin. And I'm not so sure it can't penetrate the cells. I mean, that's one of the
I'm
biggest
not either.
questions. And so I would like someone to do that at some point and report back to us. I don't know if viewers realize, the process of acquiring and getting antitoxin is very difficult. It has to go through multiple government agencies and ultimately is released by the CDC. And then the person is required to be admitted into ICU.
Yeah.
So they put you in the ICU because if there is an anaphylaxis or serum sickness that happens during the administration of that product, because it's dripped really slowly over a long period of time, that you're in the ICU so that they can save your life, if one of those reactions happen. And so, yeah, it's still a risk. But everybody, I will say pretty much universally, everyone that I've talked to says that they would rather have taken that risk,
Yeah.
so that they didn't have long-term suffering, which is really interesting. Let's see here. I thought I saw another question come in. Oh, the gal is answering back. She said she was the sphincter and the sphincter muscle. The
Hmm.
GI said it sounded related. The colorectal surgeon who injected it, of course, did not. He also dismissed all of my symptoms, and that's how I ended up in the ER. I'm so sorry that happened to you. And if you're not a member, I'm looking at your screen name to see if I recognize. If you're not a member of our support group, we would love to have you join us. And I think a support system is really important for people who are suffering adversely from this toxin, to surround yourself with people who understand. And we are always accepting members into our group, and we would love to have you. We have a link in the bio if that's something that you feel led to do. Let me just keep scrolling down here. Someone says, wow, I stopped almost 2 years ago because of my health issues avoiding toxins. I wonder now if my issues had anything to do with the Botox in the first place. Really possible. Um, this is a very good question from Botox No More. That's Morgan. Hi, Morgan. Morgan shared her story a few weeks ago. She's one of the pinned posts on the page, guys. She's curious about your GI system and how it's working. Have you had any bowel movement issues? Do you have to use laxatives? Did you have any paralyzed bowel or bladder, Angelica, early on or later?
I wouldn't say that I had paralyzed bowel, but definitely struggled with constipation in the beginning. Things
Mhm.
were sluggish. That has since resolved, just like a lot of
Wow.
my other symptoms. I also had some weird urinary symptoms. It felt like a UTI, which is common in the group as well. But
Yep.
then you run into a tricky situation because most of the antibiotics that they would offer for a UTI will just worsen botulism
Mhm.
symptoms.
Yep.
So I just stuck it out and eventually those symptoms went away.
Wow. It's awful. It's like it hit every single body system of yours. Was there a
Yeah,
body system not impacted? I don't think so. Have you had any of the neurological stuff? Did you get a lot of brain fog or memory loss or trouble finding your words? Did you
I
have any of
did.
that? You
I
did have
did.
that.
Yeah. Yeah. Trouble concentrating, the brain fog. Again, these were all symptoms that I had for about 6 to 8 months. And then they slowly kind of started to go away. Besides when I would have relapses, they would come back. But um, yeah, I definitely had a lot of those
Oh, that
symptoms.
too. This is a really good question. How did you cope with the trauma of the experience? Tell us about your coping skills and what you've done and tried that's been helpful.
I think the biggest thing was the support system that I have. I would not be able to do this without my husband, without my daughter. They were the ones that got me through. Um, yeah, I don't even know what to say without crying.
It's okay. We won't
Um,
get you crying.
they, yeah, Jake has just been a rock through all of this. When I didn't have the tube, he would try to make me things all the time. And since I got the tube, he's always just assured me that that doesn't change the way that he looks at me. I mean, he's just been amazing. Um,
Wonderful.
so if
Wonderful.
I didn't have them, I think I'd be in a very different headspace because I think I pushed through for them. I pushed through for my daughter. I do everything for her. So
Yes.
that is ultimately what makes me keep going.
It's amazing. It's so, so, so important. And we have people, guys, in our group who don't have that support system around them, which is one of the driving reasons why we started this group and we do what we do, because not everybody is lucky to have a Jake and to have family members nearby or even ones that are supported. It's huge when you're in a long term healing journey like this. I'm just going to scroll down. Um, this is so nice. Just want to say that you are so amazingly clued up on all of this, both so intelligent and beautiful. It's really nice.
It's really nice.
Um, so is there yeah, what is the prognosis with the swallowing? She mentioned earlier, but go ahead and repeat kind of your prognosis at this time.
Nobody knows. There has not been a physician that has been able to say, I expect this to go away in everyone who has said it would be 3 to 4 months, and that clearly didn't happen. Um, through my own research and through talking with other women in the support group who have been affected kind of long term, because there's a lot of people in the group who have symptoms for like 6 to 8 months and then they go back to a relatively normal life. And then there's some of us, these long haulers that have symptoms for years, if not decades. And I land in that group. And so when I've talked with others, I think the one that really stands out to me is a woman who is 25 years out. She got Botox for migraines, and she says that she's about 95% improved today. And, she said that it wasn't any point, it wasn't like at 5 years was a significant improvement or at 10 years. It was just an incrementally slow improvement.
Mhm.
And so I think my best guess is 10 to 20 years is what I'm hopeful that my swallowing will improve.
And likely will be due to new nerve growth, right? That is
Right.
replacing the ones that were intoxicated. I don't know if viewers realize this, but the way Botox work, it's a protein, right? But it's millions and millions of protein molecules. And so there's early model animal model studies that were done on 1 unit of Botox, and 1 unit of Botox corresponds to the amount of toxin that it took to be lethal to a 20-gram mouse. And these early studies show that it's 20 million or just over 20 million protein molecules in 1 unit of Botox. Okay, now multiply that times a regular dose of like 50
Right.
units. We're talking about trillions of nerve cells in the body that are being impacted by this toxin, that it's messaging, it's blocking the chemical messaging system in those nerves. So this is extensive. And then if those toxin molecules go where they're not supposed to go and they don't stay localized, we can see why these reactions occur, can't we?
Yeah.
Yeah.
And then we don't fully know if active toxin is staying in the body this long.
Yeah.
That's the other question I have. Is this still active toxin recirculating, causing
Mhm.
my ongoing symptoms?
Yeah.
Or is this just the long term effects of the damage that it's
The
already
damage.
done?
Yeah. And even
Eh,
the early founders say that they don't know, right? They say it has an extraordinary persistence in the cells.
yeah.
And people like to argue that those aren't human cells, right? Those are in vitro studies, but it's significant and it matters. And they're seeing long-term persistence in those cells. And so that's what we're seeing happen in patients too. That's what we're seeing in your case.
Yeah.
And that's what we're seeing in other forms of botulism as well. So, this is iatrogenic botulism, but we also have foodborne botulism and
Right.
wound botulism and the other types. And even people who received antitoxin from foodborne botulism have side effects many, many years later. So that suggests that there's activity there still.
Right.
Right. Wow. What a great life. This has been the questions you guys have been incredible. Someone says, so tox stays in the system forever. We don't know. It's a theory. And in my mind, I have a pretty strong opinion on that. I lean towards the potential of yes. And I base that off of different studies, but time will tell. Hopefully, we'll know the answer at some point. I'm going to ask if there's any other last minute questions. It does say, oh, I do see one here. Thanks for your bravery for sharing your story. You're strong and beautiful. And is it possible is it possible to accept this state as it is now for you, or is it still very difficult? That's a great question.
That is a good question. Um, I have good days and bad days, and I think that's what I'm working towards is acceptance. And some days I feel like, excuse me, I feel like I have accomplished that. And there are other days where I go back to my anger and my grief.
Mm-hmm.
And so I think it
Mm-hmm.
will just be a cycle of those things um, for a very long
For a
time.
very long time.
But in my day to day, for most of the time, I would say yes, because I try to focus on what I do have in my life, and I have a lot of great things in my life. I focus on my relationships and my friends and my family and my daughter, and that allows me to kind of move closer to acceptance.
Mm-hmm. Mm-hmm. This was a great live. Someone says, and thank you for sharing your story. Angelika, thank you for sharing your story. It's so impactful. It means so much. And I hope that this reaches who it needs to reach, as many people as possible, so that they can have true informed consent about when this neurotoxin goes south, what could happen to them.
Yeah.
Um, and we've been running for about 40 minutes, so I think we'll close it out now so Angelika can get back to her daughter since it's the weekend, and I'm sure you're going to work tomorrow. People are saying thank you. Thank you, everyone who watched. I appreciate the amazing questions. And again, Angelika, thank you so much. And I know you and I will
Thank you,
be
Gretch.
chatting later. Okay, bye, guys.
Bye.